We're going to talk a little bit about putting on or donning and removing PPE in the correct order today. So the first thing that you would put on would be your gown. One of the things that you want to remember when you're wearing PPE is that the inside is the clean side and the outside is the dirty side. So as you're putting it on, try to avoid the outside as much as possible. Try to place it on and tie the ties securely so that it stays in place. The next thing that you would put on would be your mask. Now we have two different types of masks that we're looking at here today, and it depends on what kind of environment that you are in. The first is just a procedure mask, or sometimes it's blue or white, and that mask, you just want to make sure that when you're putting it on that you avoid touching the outside of it, put the ear loops around your ears, and then make sure that you secure it by bending the metal part at the nose and pulling it securely under your chin. The other type of mask that you may wear is called an N95 or a KN95. This type of mask you also apply in a similar way. Again, making sure that it's fitted at the nose. And this one would be used more in COVID-19 positive or recently recovered situations, but your supervisor will let you know which one to wear. So we're just going to continue with this one. So this would be the second piece. So first the gown, then the mask. The next point of PPE that you put on is your face shield. And with your face shield, again, you want to avoid touching the outside as much as possible. So put it on using the headband and making sure that it's secured in place. The last thing that you apply is, of course, your gloves. The reason for that is that, again, you don't want to be touching everything else. You also want to try as much as you can to avoid touching the outside of the glove as you're applying them to keep them clean. And once they're on, you want to consider again that the outside is dirty and the inside is clean. So then once we provided care, it's time to take off your PPE. And the first thing that you want to remove are your gloves. When taking off your gloves, you want to remember to first grab the outside of one glove and pull it off, avoiding touching the outside of that glove with that same hand. For the other hand, you place your fingers underneath the glove and pull it off, again, avoiding touching the outside of the glove, rolled into a ball, and throw it away. The next piece of PPE that you take off would be your face shield. Just take it off, either discard it or sanitize it. The next piece of PPE that you would remove would be your gown. Undo your bows in both places. And as you're taking it off, try to make sure that you're touching the inside of your gown and rolling it away from you so that the outside is rolled to the center. Inside, if you have a disposable gown, you would just throw this away. If it's a reusable gown like this one, you would use a disinfectant on the outside and hang it until dry. The last piece of PPE that you would remove would be your mask. Again, you would want to take it from the ear loops, pull it away from your face, and then dispose of it. If you are reusing some masks, such as your KN95 mask, you would hold on to the strings and you would put it into a paper bag for storage. Hand hygiene is one of our best weapons against the spread of infection, especially for us as healthcare providers. So first of all, you want to make sure that you use probably about a nickel size amount of hand sanitizer. Put that on your hands. And the most important thing about sanitizing or cleaning your hands when you're hand washing is the friction. So you can see that I'm moving my hands around and that I'm getting onto my thumbs. I'm rubbing my nail beds on my hands. I'm making sure that since I'm wearing a ring, that I'm sanitizing and rubbing under there, and also right up into where my watch is. You want to make sure that you continue to do this until your hands start to feel dry. It's also something that you can do. I know a lot of people, when they're hand washing, they'll sing happy birthday twice or twinkle, twinkle, little star. But you want to make sure that you're getting enough time because you want to kill all those bugs on your hand.